Hi, everyone. Thanks for joining us. I'm going to give it a minute or two for everyone to be able to log in. All right, I think a few more people will be joining us. My name is Dawn Yargeau. For those of you who don't know me, I'm from the Office of Admissions, and I am so glad that you're joining us today for our on-ramp series on what to expect and the clerkships. We have three wonderful guests that are happy to join you and share their information. We have a couple of housekeeping notes. You will be able to ask us questions through the chat feature. When you're in the chat feature, please make sure that you choose sending it to everyone so that we all can see the questions and everyone else can, and we will answer them kind of more toward the end of the presentation today. So I would like to introduce our Associate Dean of Clinical Medical Education at Wayne State University, Dr. Christopher Steffes. We also have two M4 students who are here finishing up their medical education on their way to residencies, Sabrina Bernardo and Cullen Hudson. Thank you all for joining us. And I will let Dr. Steffes kick us off and get moving.
Okay, I hope I am sharing the correct screen. Don, you're going to give me a thumbs up on that?
You're good.
All right. Thank you. So welcome, everyone. I'm going to hopefully just spend a few minutes and leave most of the talking to the important people, Cullen and Sabrina, on this call to tell you how the clinical education unfolds during medical school. But let me take you through some basics here so you know really what's going on. We like to call this our highways curriculum. And because we're in Detroit and everything's auto, and we keep going with that metaphor with on-ramps and off-ramps and all that kind of stuff. And our latest course, as you see, is entitled the Cruise Course, but we'll get to that in a couple of minutes. Overall, we have 3 phases and 4 segments: pre-clerkship, clerkship, and post-clerkship. So when we talk about the different phases, we use that interchangeable with years. You may be hearing year 1, year 2, year 3, year 4. We still say that, but it's not a calendar year, July to July or January to January. They're in different segments with different lengths. This is just a review of what goes on in the pre-clerkship phase, where there's segment 1 and segment 2. So you see that you start your second year of medical school in the first year that you're here. The clinical training, however, starts right away in the clinical skills course, in service learning, and in the P4 course, and possibly in some electives. So this is one of the changes we made going about 7 years ago now, really based on student feedback that they wanted more clinical experience in the early years. And this is what we've really converted to now, is to have a 4-year program in clinical excellence that's carried on through the curriculum. The longitudinal courses that are really clinical content during the first 2 segments, year 1 and year 2, if that's what you want to call them, is a small group campus-based course called the P4 course. You can see what that stands for. Our clinical skills course starts out in first day of the first month of medical school. It always does my heart good to see students in the new white coats sitting there ready to come in and practice clinical skills. And in the start, this is done with standardized patients and is coordinated along with the didactic material that's going on in the other introductory courses. Service learning is community and project-based in involvement in the community and taking care of real patients. And that is really can grow your skills in there. The CEC, the Clinical Experiential course, starts in the beginning of segment 2, so that would be in April of the first year. And in the CEC, you are sent to a outpatient clinic in primary care. It's a half day every other week, but it's not shadowing. You're actually involved. The course has objectives, different procedures that have to be done. And we expect you to learn very well during your second year, and this really prepares you well for clerkships. One of the things that has that the feedback that we've gotten from the docs in the hospitals that our students, since we started this program, have come in much better prepared and really ready to hit the ground running when they start clerkships. So clerkships start in April. I'll have to go back here. In April of second year, so your second year, but we call it segment 3, the clerkship, and they go on in 4 blocks. And I'll talk about the details of these, but you'll do the blocks, and then we have a longitudinal course that we call the CRISP course that goes on throughout the 3rd year. In segment 4, post clerkship, there are a lot of clinical rotations and longitudinal courses. So this is a basic structure. Let's talk a little bit about in detail what goes into segment 3 and segment 4. We look at the whole curriculum really for all 4 years, but especially in the clinical curriculum, as united with some themes and trends. And this has really guided our change in this. Part of this has been shifting the calendar, which took a couple of years. We've, in the last 5 years, changed the length of the clerkships to try to adjust for core material. For example, we made internal medicine from a 2-month to a 3-month clerkship because that is the core material for all clerkships. And by the way, it's 60% of the Step 2 exam. We've built in wellness, breaks, and balance. We've built that into the curriculum. We've changed how we do evaluation and grades based on some direct feedback. We've really tried to put emphasis on self-directed learning amongst the students and added a coaching component to this. We're starting, well, we've started already, but we're moving on, continue with competency-based evaluation, which means that you demonstrate that you're competent in basic patient care professional activities. We've worked hard to integrate the curriculum so that what you're seeing in didactics gets carried on in the skills center. And we continue to look at our changes based on our reviews. We review our curriculum and love to make big changes in it. So getting to clerkship, we do prepare you clerkship. We have a pre-clerkship course, which now is going on. It's actually going on now in concert with the Step 1 preparation. So we have a lot of things that we put in here to get you ready to start clerkships prior to stepping on there. But the most important thing is the CEC and the clinical skills that go on all year. As far as themes go, ambulatory medicine is something that we touch in several courses. We don't have a course that's just ambulatory, but that's called ambulatory medicine. But in family medicine, during 3rd year, that's an all ambulatory course. We have 3 or 4 weeks during our internal medicine course, which is ambulatory, where you work in the clinics. As I said before, our 2nd year CEC course is all ambulatory. Half of our PEDS rotation is ambulatory PEDS, 3 of the 6 weeks. And then certainly when specialty rotations, you have clinic and engage in outpatient care there. This is really a change in the way medical school has been done in the past 10 years or so, because most of medical practice is outpatient. And we really work hard to get students in the clinical years more experience with ambulatory. Communication is a is the part of clinical medicine that is important. We have a curriculum in communication. We have exercises. We continue to build that across all the clerkships. And we continue to work on how we mentor, coach, and advise students all the way through. So as far as the calendar goes for when you start clerkships, there's an orientation. This was a couple, we changed the dates as the calendar changes, but there are 12 months and we have 4 blocks of 12 weeks, which gives us 48 weeks, which means that we have vacation weeks built in. And the calendar, for example, will look like this. So when you start your clerkship year, we're starting on April 1st, and we have everything in a 3-month block. So you go April, May, June, and then there's a week off in June. We go July, August, September, and we have a week off in September. This happens to be this year's calendar. So that we have this time, this built-in wellness time at the end of each one of these blocks. And then this may be a 12-week or 3 1-week or 2 6-week blocks. So if we look at the way the blocks are organized, this is an actual schedule. And when we schedule students for this, we'll just put their names right over here on the left and line them up in the schedule, because it's got to go in lockstep. So it depends on what you start on, your sequence will continue on. So if you start on this block, you'll be doing a month of neurology, a month of psychiatry, a month of family medicine, then a break, then 12 weeks of surgery, then a break, then 6 weeks of OB-GYN and 6 weeks of pediatrics, then a break, and then 12 weeks of internal medicine. And you can see how this works out for each student. We also have the longitudinal course that continues on throughout the year. So things that we've reformatted over the past 5 to 6 years have been the clerkship lengths, have worked at a core curriculum in the longitudinal course. We've added a coaching program and a clerkship orientation course, which we have not had previously to this reform. And again, our clerkships, the subjects that we have, the one block here of psych, neuro, and family, a block of 6 of peds and 6 of OB-GYN, and then 12 weeks in internal medicine and surgery. Our internal medicine block includes ambulatory medicine and also medical subspecialties. So you may spend a month on the general medicine team, and then 2 weeks doing cardiology consults, and then 2 weeks doing rheumatology, and then 4 weeks in the clinic, for example. So it's different specialties involved. In surgery, it's 12 weeks, which is a long time if you're not going to be a surgeon, but everybody does 2 weeks of anesthesia during that time, and then rotates on surgical specialties. So you may spend a month on general surgery floor, and then a couple weeks on orthopedics, urology, ENT, and the other subspecialties. I just had to mention ENT and urology for the sake of Sabrina and Cullen. I don't want them to feel left out, since that's what they're going into. The CRISP course is our clinical reasoning course. It's a longitudinal course that meets Monday afternoons every 4 weeks. And these are some of the topics that are in there currently. We continue to add topics to this. And we've recently made big changes in our evidence-based medicine curriculum to carry on what's done in 1st and 2nd year to a capstone project in the 3rd year. As far as physical locations, I'm going to show you some pictures of large hospitals here. And when I first was looking at Wayne State as a place for residency in 1985, I was so impressed with the pictures and the large number of hospitals involved. And I think it's very impressive to see the large number of affiliates that we have and opportunities, not only for 3rd year rotations, but for 4th year rotations. These are the hospitals that our students will rotate at. First is in Dearborn. It used to be known as Oakwood Hospital, then it was Beaumont Hospital, and now it's called Corewell Health East, but it's the same hospital. It has excellent programs. Ascension St. John Hospital is over on the east side of Detroit and has grown into quite a large medical center, including a children's hospital there. Henry Ford Hospital is a major affiliate that is in downtown Detroit. They are planning this brand new tower in I don't know what the completion date is, probably 2029 or something like that. But they're growing their campus tremendously with this new tower they're starting to dig ground right now. We have a mixed campus, or I should say a shared campus with Trinity Hospital's system. One site is in Pontiac, which used to be called St. Joe's and now is called Trinity Oakland. And the students will do several months here and then several months at the St. Mary's Hospital, which is in Livonia. And they're both in the same system. And then our newest addition this year is Ascension Providence Medical Center, and there's 2 sites there, one in Southfield and one almost brand spanking new hospital in Novi. And then a site that is right next to the school, the Detroit Medical Center, has multiple sites: Harper Hospital, Receiving Hospital, the DMC Surgery Hospital, Sinai Grace Hospital. And if you look at it from the air, it is a massive amount of buildings and opportunities for clinical rotations. And right across the street is the VA Medical Center, which is a fairly new building. And the students go back and forth between the VA and the DMC since they are across the street. We have a coaching program during 3rd year where every student is assigned a clinical coach. This is someone who does not evaluate them, but meets with them at least quarterly to go over their presentations, clinical reasoning skills. And they don't evaluate, but there's someone that you know in the hospital. We started this program at the beginning of the pandemic because we had to make a lot of adjustments based on the lockdown and everything. And it's turned out to be a fairly good program for our students. So moving on from clerkships to the 4th year, or M4, which starts 3 months earlier. We've changed this a lot in the last couple of years. Starting rotations in April rather than in July has been a great success. This gave us the opportunity to put in grades and comments for our MSPE, which is a dean's letter that gets sent to residency program. And that's been a very good advancement. There's students that finish 3rd year and don't know what they want to go into. That's pretty much normal. And they've got extra 3 months to figure out what they do want to go into, which has been a great success. We have added a residency prep course for all students, and this is in April, except for those in some surgical specialties take it a little bit early because we need a bigger center. But this has been a very good program and much appreciated by the students and prepares them for residency. The Teaching, Learning, Clinical Reasoning course, which we call the TL Med course this year, involves all students. And I talked before about a 4-year curriculum of clinical excellence. This is the top of it, as our 4th year students go back and teach the 1st and 2nd year students. There's nothing to get you skilled in clinical medicine like teaching it. And the students are prepared for these teaching experiences and then go back. They also teach some of the P4 courses, small group leaders and so forth. And we expect this out of all our students. And actually it's a required course that you'll do all during the senior year. We have a longitudinal cruise course, we call it now. And that is continuing to develop. It's our 1st year this year, and we're continuing on with that course. We have put in 2-week rotations the last couple of years. We couldn't do those in the past, but this has been a big help in getting students some breadth in clinical experiences. For example, students that are going into family medicine, maybe they don't need a whole month of urology and ENT, but a 2-week rotation would help them with seeing these common office conditions and knowing when to refer and so forth. So we've moved all these. Our biggest win we've had this year that we're putting into place, well, actually for the class of 2025, is that we've moved graduation from June to May. And this is in line with other schools. And we noticed that a lot of our students couldn't come to graduation because the residencies are starting early in June and they couldn't make graduation. They're supposed to start in July, but they've been starting early. So we made a big adjustment in our 4th year to change that. And when we look at segment 4 in our 4th year, we really expect a lot out of the students. And we've broken this down into what we expect from the students and what the students expect to do to really help map out what their learning plan is for the year. And actually this year, at the end of this month, when the students finish third year, we're going to meet with all of them and have them map a learning plan out, which is specific or whatever residency they're going to go into. So all these things are part of our career preparation, and especially discernment. It's a time to do electives. We give a lot of freedom for students who need to do audition rotations, and in highly competitive fields, there's got to be time for away rotations. So we do have that. We do have the luxury of having all these medical centers that I showed you. So our students in fourth year can find specialty sub-internships in just about every field. I haven't learned one that we don't have it in yet. We also have what we call competency-based certifications, our acting internship, where the students are evaluated in really a growth mindset to see what they're ready for and what they're not ready for, and help plan out so that they're ready for residency. And then we include in our fourth year care of the acutely ill patients, care at the extremes of life, with some special curriculum that the students take place in. Everybody does an emergency medicine special month as one of our required clerkships. And then other things that we can include in the fourth year as students individualize their plans into ambulatory experience, and many opportunities to do more research and research electives during the fourth year if it fits into their plans. So our schedule for fourth year really looks as such now, where we have required courses, but we have mostly elective courses. And very importantly, we have a month reserved for step 2, and then vacation months that can be used for additional study as needed. Kind of summing up here, we're working towards a more integrated curriculum to go from year 1, year 2, year 3, year 4, and emphasize clinical teaching. The clerkships are really the high point, the busy point, and you'll learn from Sabrina and Cullen how intense that these can be. But we are working towards making them into more of a continuum than separate courses. And again, this year we've changed a lot in our fourth year in order to get students an extra month at the end of medical school to move their residency and so forth. We've put in acting internship and longitudinal courses. We've actually put in really 2 vacation months that would help with individualizing study plans and so forth, and keep working on being more flexible. And our cruise course, again, we're working at filling this up with longitudinal themes. One of the big ones is going to be communication, and we're building that out this year. So in the end, I will say that in clinical education at Wayne State, there's 3 types of medical students. All right, there's 3 types of medical students around the world. There's those that make things happen, there's those that watch things happen, and those that say, what the heck just happened? At Wayne, when you are Wayne trained, you're one of those students that make things happen. And we look forward to all of you joining us in doing that job. All right, with that, I am done, and we'll turn it back over to Don.
Steffi's, you're actually not done, because I'm sure we're going to have a lot of questions for you. And we will be posting this website. I know it went really quickly, but some of those slides look to be very valuable to all of you. So I am now going to introduce you to Sabrina Bernardo and Cullen Hudson, and they're going to tell us a little bit about themselves, and they have a PowerPoint to share as well.
Hi there. Hi, everyone. My name is Sabrina. Yes, I'm a 4th year medical student here at Wayne State University, and I applied to otolaryngology, head and neck surgery for residency.
Hello, everyone. I'm Cullen Hudson, again, 4th year medical student at Wayne State, and I applied urology, and I actually matched early February, and I'll be going to Mayo Clinic, Arizona. So pretty exciting.
Yeah, and we're so happy to be talking to you today. I was really motivated to be part of this session because I believe like my third and fourth years here at Wayne State have just been phenomenal. Truly, truly wonderful. But what led us to Wayne State in the first place? So I am from Michigan originally. I went to the University of Michigan in Ann Arbor for undergrad. But I believe Wayne State really brings great opportunities to care for a really diverse and vulnerable patient population. And then, of course, the robust hands-on clinical experience. I've heard medical students at this school, just have wonderful clinical experiences. And, that ended up being so true, and then so much more. And then also, this medical school has a great reputation, not just within the state of Michigan, but really around the country. And then for me personally, I thought the geographic location was great. It was close to family, but also living in a downtown urban environment was exciting to me.
Yeah, I just want to add that I can't under or overstate how awesome the patient population is that we serve. You really kind of get to see a little bit of everything. You get to see people from the suburbs, you get to see people from the city, from in between, and it's really just a true pleasure to be able to get the opportunity to work with all these individuals. And I'll touch on this. I know Sabrina kind of touched on it a little bit, but the clinical experience that you get is insane. You really get an opportunity to really be a top dog when it comes to medical students. I'm not sure if you felt the same way, but on my away rotations at other universities and other hospital systems, I was consistently praised for how I approach things, and it was just kind of like how I learned from doing my rotations here. So you really are kind of the cutting edge of clinical experience when you're here. So it's pretty cool.
Totally. But yeah, and then just talking more about our clerkship experience, my time here has just been fabulous working with the residents and the attendings. They really are eager to teach medical students, and they're also very active in academic research, which has been wonderful. And then going along with the patient population that we serve, you're not only trained in seeing, well-off suburban patients, but you also are trained to care for some of the most medically complex and underserved patients in the state of Michigan. And so this can be daunting at first, and it can also create, additional work, but that will only serve you, better in the future. Because if you're trained to take care of some of the most complex patients, those less complex patients in the future will just be that much more manageable. And this also created more opportunities for medical students to be involved. I was calling social work, collaborating with the ancillary staff members in the hospital. It's it teaches you how to be a very self-sufficient medical student and how to get things done. So I'm very grateful for that experience. And I can't say this enough. It's so hands-on, doing lots of procedures, including putting NG tubes in, Foleys in, IVs, suturing in the OR, and even intubating under supervision, of course. But also, like Colin was saying, when I did my away rotations at other medical schools and medical institutions, yes, people commented about, how self-sufficient I was. And, I think I gained a lot of trust on those rotations just because I knew, um, how to handle myself, and also how to operate as a very independent medical student. And then also, I would like to point out the 3-month blocks for surgery and medicine. So this is great because it allows time for subspecialty exploration. When you're on surgery, you do get to go on anesthesia, which is fabulous. And then you can experience other subspecialties like ENT, for instance, and urology and plastic surgery and cardiothoracic surgery, pediatric surgery. Like that it's so wonderful. And then for medicine also, you get to go on different services. You get to explore like cardiology, pulmonology, ICU medicine, rheumatology, endocrine. So the exposure you get is just incredible.
I just want to touch a little bit more on kind of the residents and the attendings that you work with. So I remember my first day, my first rotation was pediatrics. I felt like a fish out of water. I didn't really know how to approach the whole entire thing. While you do get a great experience in your pre-clerkship years, it's nothing like being like on the floor in that situation. So I remember first day I asked one of the residents, like, hey, I introduced myself, told them it was my first day, and just asked them to, potentially show me the ropes. And they were overjoyed to even have medical students be present and assist in that whole process. So everyone at all the hospital systems is extremely eager to work with you and teach you just how to become the best medical student and future physician possible. One thing that also really stands out is if there is, a field that you're interested in, you'll have, and you are like seeing patients of those kind of subspecialty, you'll see a lot of opportunities to get into the research realm and potentially write up case reports and case studies on the patients that you see. So if you are, maybe not the most research savvy or most intensive in your first 2 years, there are a ton of opportunities once you do enter your like clerkship year. So never feel like you're kind of a little bit behind it at that point. But yeah, a lot of opportunities in your clerkship year.
Yeah, and so this last slide, or last response we have, how has Wayne State School of Medicine clerkship phase help us find success? I mean, it's kind of hard to sum up in just one slide, because I think this clerkship phase has really been instrumental. But I guess I'll just reiterate that it really fueled my ability to function as an independent and high-level medical student. Even in institutions that I wasn't familiar with, the foundation that I found here at Wayne State just propelled me forward. And then another note that I don't think I really realized before starting medical school is coming to Wayne State. A place where they have established connections with a lot of different institutions creates a great opportunity for you to form connections with multiple home residency programs. So, personally, for me, applying to otolaryngology, I got to spend time with the Wayne State program and also the Henry Ford program. So that created, more letter writers and just exposure to the field. And then also the 18-month didactic or like the pre-clinical clerkship phase allows for more time during fourth year for that extra professional development that Dr. Steffies was talking about, the audition rotations, figuring out what exactly you want to go into, studying for step 2. You get done with all of that pretty early and it's very beneficial.
Yeah, so Sabrina basically covered all the highlights there, but I just want to really kind of make sure that you understand that, like it or not, you're going to be ready as a medical student. You're going to be at the top of your game by the time that you're finished, and the overall experience is just something that I don't think you'll be able to find at many other programs. And it's just a really, really great way to start off your medical career. Like we kind of said earlier, we did away rotations, and I vividly remember people being like, "Wow, you're kind of like the most competent medical student I've ever met. Like, what are they? What's in the water? What's in the water in Detroit? What do you guys got going on over there?" So really, really strong clinical experience, and I can't overstate how wonderful the experience is.
Yes, and then I just put together so a sense of picture is worth 1,000 words. I threw together some pictures throughout my clerkship time here at Wayne State. And so this is the clinician ceremony. So since Cullen and I started medical school during COVID, we did not have a white coat ceremony. Instead, we had this clinician ceremony, which was a ceremony right before we started clerkships. It was just a really nice way. To begin the next phase of our medical training. Here's just a picture of me and my friends at the ceremony. Next slide. So this is me. This is me doing an ultrasound with my resident in the emergency room when I was on trauma surgery. And then this is a picture of my team while I was on the trauma surgery rotation. We were all getting breakfast together after our call together. So this man in the front is actually, oh, sorry, wait, go back. This is actually our attending who took us out, which was really nice. And then all of the surgical residents and myself. So it's a really good learning environment, and we have fun with each other too. Okay, now you can go next. And this is just a slide with all of, my classmates and also residents that I worked with during my clerkship experience. This again, top left is my surgery team. This was just 1 month that I spent with them, but you can see we got pretty close. Um, and then, yeah, just some of my classmates on rotations. I don't know why Anthony and Noah are so happy in the trauma surgery workroom, but we have a great time. Next slide. And then lastly, this is on the left, that is my very last day of third year. I was feeling sentimental, so I wanted to take a picture. And then also on the right, this is an example of what Cullen was talking about earlier. Um, I wrote up a case report on an interesting patient that I saw during my third year, and I was able to present that as a poster presentation. Um, and yeah, it's just been such a wonderful experience. I'm really looking forward to answering your questions. Um, yeah.
So now would be the best time to put questions in the chat. I have a few questions that were put into the RSVP form, but real quickly, I'm going to ask Sabrina really quickly. I know Cullen started on the PEDS rotation. What rotation did you start with?
So I started on neurology. It's a
Okay.
1 month rotation. Um, And it was wonderful. I thought it was a good foundation. I appreciated that I got to do surgery over the summer. So I got to get my feet wet a little bit in surgery and found my passion for the OR.
This is a question from the chat. It'll be for Dr. Steffies. What is the exam schedule like during clerkships? And I frequently get the question, is it pass fail? How does that work?
Each clerkship has what we call a shelf exam at the end, and there is one study day before the clerkship or the exam. The exams are on Fridays. And it is challenging with a 1 month clerkship. So you've got neurology, you got a test. 4 weeks later, you got another test. 4 weeks later, you got another test on family medicine. So, but the reason that we like these tests is that it gets you really prepared for step 2. Now, step 2 CK, everybody knows that's the be all end all now. That step 1 is pass fail. And so going into different specialties, you need a good CK score. We do have a final exam, a comprehensive exam at the end of third year that covers all of them, which is more or less a practice test. That's not, we don't grade it. You grade yourself on that one. But the whole gist of this is to get you studying all year long. And most students are doing that. They use UWorld. Colin, Sabrina, you guys said UWorld the whole year long. And so I know both of you and our students were really prepared. We had really great CK scores. This class of 24 was phenomenal. So, but their schedule, there's a test at the end of each one.
And so is it pass fail?
No, the clerkships themselves are graded. So it's honors, satisfactory, or rarely, once in a blue moon, unsatisfactory. But the test will be scored. There is a passing mark. And if a student doesn't reach the passing mark on the shelf exam, they'll have to take it over. They get another chance to take it on a usually on a vacation, so they're not studying for something else. There are also commendations. So if you do well on an exam, you can get academic commendation. The majority of our students get clinical commendation on courses. And if you kind of put both together, then you get honors. But the majority of our students will get clinical commendation because we expect them to do well, and they do well.
Yeah, and I would like to say one thing too, in regards to grading during the clerkship phase. So I think it's very, I think it's very, what's the word? It's equitable and fair in the way that if you study and you perform well on the exam and you performed well during your rotation and got good, clinical evaluations, like you can get honors. There's no cap in the amount of students that can honor. I think except for surgery, that's a little bit different. But in every other one, if you work hard and you do well on the exam and you did well during that month, you can get honors. And that's in contrast to some other medical schools where they only allow a certain percentage or certain number of students to honor. And I think the way that we do it here at Wayne State is very fair. And I think it allows students who work hard and performed well to be well recognized for that.
I have a student who wants to know if you could walk them through a day in the life on a surgery rotation. Like, what time are you in the hospital? What can medical students do in the hospital?
Yeah, I can jump in on that. So first, it really kind of depends on which rotation you're on. So if you're on, general surgery, things will usually start around, well, rounds, first of all, kind of start around like maybe 6:30, maybe a little earlier, because OR time usually starts around 6:37. So that's when the surgeons are in the OR operating. So you want to make sure that you see your patients and everything beforehand. But as a student, it's best to, be there a little bit earlier than that. So you have time to check up on your patients that you had maybe the previous day in the OR, or to even kind of just help with the housekeeping with the residents, maybe make the list or get numbers for your residents to help them out. And that essentially is getting their labs. So checking their hemoglobin, their white blood cell count, electrolytes, all these things, and having them ready for each of the patients. So it's easy to review them and everything along those lines. But surgeons don't like to waste a whole lot of time. So rounds usually only take around maybe 15 to 30 minutes. So it's usually a fairly quick process. But after rounding and all that, you go to the operating room, see what cases are going on for the day. You kind of, depending on what team you're on, you'll join those cases. And again, really subjective or objective on the day, but it really kind of depends on what's going on. So the case might go for 2, 3, 4, 5 hours, depending on what they have going. And then from then on, after cases, you go in between checking up on your patients, helping out on the floor, and then there might even be more cases. So it's kind of a day-to-day thing, but I'd say the day usually starts around, I'd say between 5:30, 6, and you'll probably get out around maybe 5:36 again, unless their residents are nice to you and they let you out early. And even some days you might be there later if there's something a little bit more interesting that you want to stick around for.
You also have night call, I believe, right?
Yes, you do have night call.
Yeah,
And Dr.
only during
Steffi is a
certain
surgeon. Yeah,
Yeah,
go ahead.
only during
Sabrina.
certain rotations. So when you're on the trauma surgery rotation, which is a month long, you're on call maybe every 6th night. And you'll stay at the hospital overnight and get called to any trauma activations. And it's very exciting. And you can be part of the primary survey. And I remember this one time we had a gunshot wound victim who had he perfed his small bowel and we had to rush him to the OR, and you could see his belly, expanding as we were getting him to the OR. And he did very, very well after the operation. But I was able to be in the OR for that and retract, and it's a fabulous experience. I'm happy the patient did well.
Dr. Steffies, how are students assigned to clinical sites? Do they rotate at different sites, or do they generally stay at one for the duration of their clerkship?
That is an excellent and complex question. The students during second year, you're assigned to a clinic, and there's a choice process, kind of to match people up there. But third year, you are assigned to a base hospital, but there are some shared sites between hospital. All the students will do a little bit of traveling because all the students will come down to Children's Hospital for pediatrics for at least 2 to 3 weeks. And but they'll spend the majority of the time at their home hospitals. That doesn't mean they're in one place. For example, those students that are based at Henry Ford may do clinics out in Sterling Heights. They may go to West Bloomfield for GYN surgery and go to the psychiatric hospital for psychiatry. So they'll do a little bit of rotating around. And so that happens on just about every one. Like I said, we share rotations this year between the VA and DMC. We changed that based on feedback from the class of 24 and changed how we assign the schedules. So there is a little bit of that. Now during 4th year, you can go to any hospital. So you will shift. You'll do a month at Ford, a month at Ascension, a month at Idaho State or wherever. So as long as things go by the months, you will be able to rotate at any of those hospitals.
What's the commute like? So Cullen, do you live in Detroit proper?
I live in Ferndale, so I actually don't live directly in the city. So the commute isn't too bad. I drive around. I actually timed it just in case I'm having a late morning, but it takes me around, I'd say between like 12 and 15 minutes to get to Detroit receiving in the morning. And usually that's with very minimal traffic. It's fairly early. So it's not too bad at all, and it's really manageable. And I honestly think it's a little bit cheaper and more affordable to not live directly in the city. And Royal Oak and Ferndale are some great options if you're looking for places.
Sabrina, do you live in Midtown or?
Yeah, so I live like right at the border of Midtown and downtown Detroit. I live very close to Little Caesars Arena. I actually walked to the hospital on most days, which was like a 20-minute walk. And then like a 5-minute drive maybe to Henry Ford or DMC. But I would like to say, like, don't be intimidated by the fact that we have a lot of different clinical affiliates. This is actually a good thing. Um, and your clinical experience will be great. And one of the great things about Wayne is that we have been in Detroit for such a long time. Um, these connections that we have with these clinical sites are very robust, they're very strong. And yeah, we've been doing this for a long time. So you'll be great.
The other thing I tack on there, Don, is that I think it was in the question, being assigned to these different sites. We do have a process where the students will turn in their preferences. We have the hospitals come in, the directors, and present little things about their hospitals, what are their strengths, what are their good points, what they, to help the students do that. And then they go through a selection process. And I think this year, 85% of students got either their first or second choice. And I think we're up to about 75% first choice. So maybe more than that. But there's limited seats at each place, but the students do have a say in that.
Thank you. Henry's asking, I think I know the answer to this one, but considering step 2 now carries more weight to match into a residency, have any students considered taking step 2 before step 1?
That's not allowed by the board. They
Right.
go in order.
Yeah,
So it's an interesting thought, though. And I'm sure many students have thought about that. But yeah, you have to pass step 1 in order to start clerkships.
got it. And having more time for study for step 2 might be to their benefit. So one of the questions was, are there any unique clerkships that Wayne State offers to their students?
Unique clerkships. Well, we have unique opportunities on many clerkships. For example, on the during surgery on one of the trauma services, we have a embedded trauma psychologist that rounds on all the trauma patients, the victims of trauma, and goes and because it's not just a surgical, issue, and the students, as part of surgery, the students as far as surgery rotation, can spend a couple of weeks with the trauma psychologist and going around. There's and then there's for example, at the VA, there is it's a 4th-year rotation on pain management. We have a couple of those, but we have a anesthesiologist who works in what they call battlefield acupuncture. So as part of anesthesia, they can also learn complementary medicine as part of that. 4th year, there are so many different once you finish your course, there's so many different, we have over 300 courses in 4th year, and many of them are at multiple sites. And yes, it is a logistical challenge to keep track of everyone, but we have a big computer system to do that.
Yeah, I was thinking of a couple unique opportunities while Dr. Steffies was talking. So one, since we are closely affiliated with Children's Hospital of Michigan, I actually was able to do 2 weeks of pediatric general surgery on my surgery rotation. That was very meaningful. And then we have a burn center at DRH. I believe it's the only burn center in southeastern Michigan outside of U of M, if I'm correct.
That is true.
Yeah, so that's a unique experience as well. And then also on the DMC campus is also the Rehab Institute of Michigan. So anyone interested in physical medicine and rehab has the opportunity to rotate there, and it's a very well-esteemed rehab institute in the country. So there's just a couple that I could think of offhand.
We also have an affiliation with a extremely huge private practice group in town that has many outpatient centers, so students can get do rotations, and we have 2 weeks or 4-week rotations at a lot of these outpatient clinics all around town to really get an eye of how things are in real practice. For example, we have a center that's out on the north side of town that is involved in breast surgery. And we have a lot of students that are going into OB-GYN, women's health, and they have an opportunity to not spend a whole month there since they're concentrating on their gynecology rotations, but to learn outpatient management in rotating with those clinics. So a lot of opportunities like that.
How are the clerkships able to provide opportunities to work with and learn from interprofessional teams and other healthcare specialists?
That's a great question. Well, first of all, it's kind of a part of your curriculum. I'm fairly sure in between your 2nd and 3rd year there is I forget the name of the course, but it's very instrumental, and you work very closely with dental students, nurses, PAs on a variety of different projects just to get an idea of how to work well with each other and kind of get a better understanding of what each of your roles entails. And I think that's what really kind of gives you an opportunity to really succeed as a group, just understanding what each person needs to do and how to get it done. But in your clerkships, you have a lot of opportunities. So on the floor, you work very closely with the nurses, you work very closely with the PAs if they're a part of a certain service. And you also have a multitude of opportunities to rotate on those services, specifically when you're on the emergency clerkship. So you have a dedicated day to work very closely with the nursing staff and really kind of get to see the nitty-gritty of what goes on in the ED. So it's a really there's a lot of opportunities to work with various disciplines of medicine.
Yeah, and even on some rotations, you'll be with maybe a PA student. I don't think I worked with any NP students. Encountered some pharmacy students as well during my clerkships. But yeah, like Colin was saying, you work closely with the nursing staff. Also, CRNAs are in the OR, and there's some CRNA students. And then also your role as a medical student, the culture here at Wayne State is, you're part of the team, so you're going to help out the team. So if that means you have to go talk to social work, that, you're going to go find social work or call them up, and get those tasks done. Or if something needs to happen on the floor, you're going to go talk to the nurse or the nursing assistant, and you're going to help facilitate that process. So I really think it's just the culture here that propels you forward, and integrates you in this, multidisciplinary setting.
And Cullen, you do remember correctly, that course is starting Monday. Dr. Levine is setting up the groups from nursing, PA, pharmacy, and the U of D Dental School to work in teams and work on various projects for the rest of the month.
And really quickly, probably our last question. We have 5 minutes left. If there's any last questions somebody wants to put in the chat. And Cullen, you briefly touched on this. One of the questions was, are there any clinical research clerkship type opportunities? And are there support resources for those students as far as research during their clerkship?
Yeah, certainly. So I'm fairly sure within your 4th year, there's an elective that you can take specifically for research. So if you are extremely dedicated or you need to build up your research CV, you could take the time to do that. But what really kind of just stands out to me is the willingness for faculty, residents, attendings to really kind of help you establish product or projects and get them going and really see them through to the end. So you could walk up to any attending or resident, a part of a majority of specialties, and they already have ongoing product or projects that you can jump onto. But within your first and second year, there's also the research elective, which gives you a lot of opportunities to kind of build that base as well, to get things kind of moving if you're interested in more for research or a really competitive specialty that kind of requires that.
Dr. Steffies, as we wrap up, any final thoughts that you'd like to share?
Absolutely. I want to go back to Jake's question from the top of the queue here. If we had to point to a single thing or two, what do you think Wayne provides where other universities may fall short? I'm not going to comment on where other universities may fall short, but I'll just say that the one thing we provide is high expectations. And I think that Sabrina and Cullen will back me up. When you step on a service, the residents expect you not to just be watching, but to go and do things. And you have to, Sabrina talked about this a couple of times, you have to be part of the team. You're actually taking care of the patients a lot of times. You're not just watching, you're going out and doing things, and the patients rely on the students, and we have high expectations. And I've heard this for many years, as Cullen was saying, when you go out with other schools, you have a lot of experience. In your 3rd year, you get a lot of experience and you show up knowing how to do things. You guys can back me up on that if you want.
Yeah, I just want to add that it's when you're in that setting, it's really kind of incredible the feeling that you get, because it's more of they have expectations, but they know that you're still, fresh on you're pretty green. You're pretty green to the situation. So it's more of a graduated autonomy. They want you to be able to really kind of take the lead on these types of things, really kind of help out as much as possible. So they'll help you get there. They'll, it's kind of like a learn one or see one, do one, teach one kind of situation where they'll show you the ropes, and then you'll kind of, get your feet wet a little bit, and then you'll be teaching somebody how to swim. So it's a really, really cool experience overall.
Cullen, did you plan on going into urology when you came in?
I did not. I knew I wanted to kind of go into a surgical specialty, but I wasn't sure of the disciplines, or which discipline I really kind of wanted to go into. I was interested in plastics, orthopedics, general surgery, but urology kind of caught my eye because of a lot of reasons. So, when it comes to the pathologies that you see in urology, from what I've seen, they disproportionately affect a lot of underserved individuals and populations. So I'm very interested in urologic oncology. And again, these populations see a big portion of these diseases. So I really kind of wanted to make an impact in these people's lives and kind of provide a invaluable service in their care, because there aren't many urologists who kind of really focus on those individuals. So I just kind of wanted to be a part of that movement, I guess.
Thanks for sharing that.
Yeah.
Sabrina, last thought.
I've just had a wonderful time here at Wayne State. Wouldn't change a thing, honestly, in my path coming here. My experience has been invaluable. yeah, looking forward to match day. That's it.
Good luck to you, and thank you all for joining us. We really appreciate the time to share with you.
Thanks, everyone.
Thank you.